Remember about a year ago, we were at the Singing River Hospital location in Pascagoula, introducing you to the new Mako robotic arm surgical system. Well, they have had such a great success with it there that they now have it here at the Ocean Springs Hospital location, Singing River Health System. Dr. Joel Tucker with Bienville Orthopedics. How are you, sir?
I'm doing well. How are you doing?
I'm doing well. First of all, before we get into this great system, give me a little bit of background about yourself.
Well, I'm a Mississippi native, and I went to Florida, the University of Florida, for my fellowship and for my residency and my fellowship at Mayo Clinic, and returned back here to the coast because I wanted to come back and work in Mississippi. I work with Bienville Orthopedic Surgery, and I've been interested in robotics, robotic joint replacements since the Mako came out. We've been doing this system for about a little over a decade. And I've done approximately 600 to 700 of these, and been very thrilled so far with its outcome and how the robot performs for my patients.
Now, you know, people think about surgery, you do knee and hip replacements, things like that?
Correct. The robot will do 3 actual surgeries for us right now. We're hoping to expand it further. It started out with the partial knee replacement, where the idea is that if you have 3 compartments of the knee that are bad and only one are present and only one of them is actually bad, you can replace that one part.
Really?
Afterwards, they expanded it to do total hip replacements and now total knee replacements.
Now, this new technology with the robotics, does it give you a safer sense of working when you're doing surgery than the old ways of doing things?
It absolutely does. And there's lots of things. I mean, the first thing to really know is that this helps to make the surgery safer for the patient. It starts out with preoperative planning. We're able to actually size and position the components for the patient. If you look on the screen up here, you can see that we're able to size them larger and smaller. He'll turn down the size of the femur component. This is the size here, and we can tell that if he goes down 1 click, it actually makes it too small, and we can go up 1 click. So we're actually able to make it too big. So we're actually able to preoperatively template, so we're not having to make those decisions in the surgery. In addition, the robot is routinely maintained by a staff service that comes and works on it. Every day that we use it, it goes through a series of safety checks before we even start to use it with any patient. One of the things that's very important about it that we really like is called AccuStop technology. And what that is basically a term called haptics, which when the surgeon plans the case, it sets parameters or boundaries where we're unable. The robotic arm will stop us if we're unable, if we try to cut outside of those boundaries.
So safety feature.
Exactly. So for instance, if the surgeon controls the robotic arm, so the patient can be secure that I'm here with the patient and doing the actual surgery. The arm can move into the position that I want it to, with different locations, and we use different tools on the end of the robotic arm to help us to do that. So if I try to push it in too far, the robotic arm will stop me and not allow me to cut something that I don't want.
So, I mean, people think about robots nowadays, and especially when it comes to surgery. I'm sure there's some of them out there probably thinking, so is the doctor out having coffee somewhere and this robot's working on me by itself? Or
No, that's the thing. The robotic arm is controlled by the surgeon. Basically, I'm not in the doctor's lounge eating donuts while R2-D2 is in here working on you. So it's here, I'm able to see what's happening with the patient, I'm able to control what's happening with the patient, and the robot is a tool that allows me to make sure that I don't do anything that wasn't planned.
So when the robot is actually in there doing the surgery, you're watching on the screen as to what it's doing.
Absolutely.
So you know you won't, you're not in there the old-fashioned way.
Exactly.
Trying to see what's going on and all this, and it's like, whereas with this, you got a right up close and personal picture of what you're working on.
Absolutely. And we're able, like we're talking about the preoperative planning, we're able to plan the joint replacement before we even start the case. So normally, or the old traditional method, we start doing, you'd have to make a cut in a series of steps. Sometimes we get to step 5 and wish that you had gone back and done step 1 slightly differently, and you have to make adjustments for that.
Right.
With the robot, we're able to look through all the different steps before we even make the correct the first cut. And that allows us to enable soft tissue balancing, which gives the patient a more comfortable knee afterwards. It allows for the knee to be aligned with proper angles. We're able to make cuts down to 1/10 of a millimeter in changes.
Now, let's talk about recovery after something like this. Is the recovery faster when doing with the robotic surgery than it was the old traditional ways?
Well, research has shown that it is. By doing it this way, we're able to be more gentle on the soft tissues. So we have seen a faster recovery for patients, saving them a couple weeks potentially in time, and that means a lot to patients.
Okay. Well, when you do the surgeries, they usually will have to go to a physician, practitioner, or whatever to get referrals to you, correct?
Correct. Or they can call BM Orthopedics and talk to us directly. So they can either get a referral from their physician or their primary care doctor, or they can call our company directly, and they can usually schedule an appointment.
I know that's one of the great things about the Seymour River Health System. If you don't have a primary physician, you can hook them up with one. I mean, if there's something that you're having problems with, you need hip surgery, hip replacements, or anything like that, to come in here and find out if they're a good candidate for it. Is there ever a case where they might not be a candidate for using the Mako?
Right now, for revision work, if somebody already has a knee replacement, it's considered not appropriate to do it for revision work right now. It'll be considered off-label use.
Okay. Okay.
So other than that, if you can have a total knee, you can generally have it done robotically, and I think it helps to allow you to give you potentially a better outcome.
So knee, hip.
Knees and hips.
Knees and hips.
Right. So we're expecting shoulders to be coming out down the line. And hopefully we're going to see some spine work as well.
Oh, wow.
But that's we're waiting to hear from Stryker about when those were going to be released.
Dr. Tucker, thank you so much.
Thank you so much.
Great information for you here. Again, if you'd like some more information on this wonderful new robotic system that Seymour River Health System has, go online. You can go to the website. You see it on your screen. Set up an appointment if you need some surgery. Let Mako do it.